What's the picture in Warwickshire for our 0 to 5s, building on the context that John has just set on behalf of Professor Barlow? I'd like to spend the next 10 minutes presenting some highlights from the 0 to 5 needs assessment that we have been undertaking in the months since we saw you last on improving school readiness, creating a better start for Warwickshire. It's a report that provides a descriptive analysis of school readiness in Warwickshire. It summarises the evidence of what works to improve school readiness so that we can improve our service planning and delivery. It's a really comprehensive report. There's a lot of information in it. So I'm only going to touch on a few of the key points. We will, when the document is finalised, put this onto our Smart Start website so that everybody can see what's in it. And I'm hoping that from the information that I can give you now, it will help set the context for our discussions later today. Now, this is where technology will probably get me. Okay. Hurrah! Got it there. Okay, first of all, I'd like to look at some demographic data. And this basically looks at how many children, where are they across our county? And it's important for us to know this now and in the future because it will help us think about where we need to focus. We have something like almost 38,000 children in this age bracket across the county, which is in the box up on your right, top right. We have about 6,000 births a year, which counts for why we have sort of neatly 6,000 or so in each of those age bands at birth, at 1 year, 2 year, and so on. We have got on the your right-hand side, some information about where the 0 to 5s might be found, in terms of their percentage per borough. And then in the colourful circle, that shows you in terms of percentages across the county, which areas have 0 to 5s, what that percentage is for the whole of the county. I think the message from here is that the boroughs of Nuneaton and Bedworth and Rugby have the largest proportion of 0 to 5-year-olds, around about 7.6, 7.7 respectively. And certainly in the Rugby area and in those areas where we will have more development going on in terms of buildings, those numbers are set to expand in the future. Again, if we need to know that in order to be able to understand where we need to look at services and how we work together. Of that 37,000 number, some 2,796 children are living in the top 20% most deprived areas nationally. And I'm going to come back to that figure in a moment. I move on. In terms of, how are we doing then when we think about our school readiness for Warwickshire children in comparison with other local authorities that are similar in makeup to Warwickshire? And we've got a list here of about 15 different local authorities that are in the same bracket as Warwickshire. We know that in terms of school readiness, Warwickshire is doing very well. We are equal, slightly more than the national figure of 66%. Those are those lighter blue lines at the bottom of the picture. We're at about 67%, but that still means we've got something like 33% of our children who could who aren't doing as well and on whom we need to focus. And we're sort of in the middle of the pack. Look where Bromley and North Somerset are, and in terms of being aspirational, I'd like to see us, at the top of that list that we have there. In the document, we have also looked at school readiness, and we've looked at that by district and also in smaller, what we call local super output areas, where we've got sort of about 1,500 or so families. Children are considered as having reached a good level of development at the end of reception if they've achieved at least expected levels in sort of 3-4 main areas. That's around personal development, so things like self-confidence, managing feelings and behavior, in their physical development, so being able to move and handle and look after their health self-care, and also in communication and language, so being able to listen, paying attention, being able to understand what's being said to them, and being able to make relationships with each other, having friends, and being happy. This is in addition also to maths and literacy, which are very key for cognitive development. We have a mixed picture going across the whole of the county, and this is a map. The lighter colours, or the darker colours, show where things are going well in terms of good levels of development, and the lighter shades show where we need to be doing some more. And the picture shows us, there are light and dark patches across the whole of the county. So in terms of tackling and improving, again, it goes back to partnership and everybody being involved in working to improve school readiness for our children. And this data comes from Department of Education statistics and analysis, and is taken from 2015. We've also, in the need assessment, looked at good levels of development at the end of reception and deprivation. I mean, overall, our county is quite affluent, but we do have pockets where deprivation occurs in both rural areas and in our urban areas. And it's important for us to consider this because deprivation and poverty in childhood have a profound impact on educational, health, and employment outcomes in later life. And I think from what John Nanan was discussing and presenting earlier, you can see how this takes place. And it also means that poverty and deprivation are linked also to linked with low school readiness, meaning that many children from poor backgrounds do begin or may begin school at a disadvantage. And we use a number of measures by which to measure deprivation, whether it's looking at family income, employment, and we also look at the levels of free school meals to give us an idea of where things are. I'm sorry this is not be difficult for you to see on this particular slide, but in the actual document you would be able to expand this and see it in greater detail. The district and borough level, at that level, probably Nuneaton and Bedworth has the highest proportion of deprivation in the county. But when you break that down into these smaller super output areas that I talked about earlier, where we have communities of about 1,500 or so, we find that across the county. And we can see where those sort of yellow and red lines occur around the blue elements. It shows you where we have areas that are either in the top 10% or the top 20% of deprivation. So it shows where it's clustering. Now, it doesn't say that all children living in these areas are deprived, but it does give us an idea of the scale of need for our 0 to 5-year-olds. And I'd like to just look at that in slightly more detail. When we looked at our analysis about the needs, we had 5 areas that really did stand out. When we start to break it down, we know that there will be differences between girls and boys. So where it says gender, the dark circle outside will be for the girls. The lighter half circle in the middle is for boys. We know that girls will probably be up to 1.25 times more likely to have a good level of development than boys. For those moving along then to first language, children who speak English as a first language are likely to fare better in terms of good levels of development than those who don't speak English as a first language. There are differences in terms of ethnicity. So pupils of mixed ethnicity are more likely to have good levels of development, 1.3 times, than children from black ethnicity. There is also difference between those children who have special educational needs and also in terms of deprivation around free school meals. So these indicate for us in Warwickshire where we need to be paying attention. Why are we doing this? Again, it links back to what John was saying earlier. It impacts on things like social skills, on a child's reading ability, maths and physical skills, and they can have long-term impacts in terms of educational outcome. There are links to things like crime, overall health outcome, and also it impacts on life expectancy, dying sooner than you might do. But there is also good news in this. We have a lot of evidence that shows us that there are 6 areas which, if we focus on them, we're likely to make some impact. There is some very good work taking place already around those 6 areas, around mental health, integrating services, and so on, which we're going to hear about later on in the following presentations. I think the big message is when we look at our needs, the only way we can tackle this is working in partnership. Okay, thank you.